Good day, ma'am. Today I'm going to perform obtaining a wound drainage specimen for culture return demonstration. So the purpose? To identify the microorganism potentially causing an infection and the antibiotics to which they are sensitive. Okay, and then to evaluate the effectiveness of antibiotic therapy. Okay, and then for the assessment, appearance of the wound and surrounding tissue. Okay, and then the character and amount of wound drainage and signs of infections. Okay, so for the planning and specific orders of obtaining wound drainage specimen for culture. And then whether the wound should be cleaned before taking the specimen and whether the site from which specimen will taken has been specified. Okay, and then I have also gathered the equipment, so these are the equipment that I need to use. Okay, and then for the implementation or preparation, check the doctor's order. So, okay, now let's proceed for the procedure. Okay, and then introduce, verify the client's identity, and explain the clients if what I'm going to do, and then how will my clients can cooperate. So, hello ma'am, I'm Joyce Amelia Goto, and you're a student nurse of CSPC. And you are, what's your name po?
Janina.
Okay, and your age po?
9.
And where do you live?
Walang galban.
Okay, thank you. So, ma'am, so for your cooperation po, just follow what I have said po, and just wait until I'm done cleaning your wound or changing your dressing, okay po? And I will go through the specimen. Okay, so, okay, and then after that, perform hand hygiene. Lotion. Okay, and then after that, provide for client's privacy. So assume that we have a curtain and close it. Okay, and then of course the door, we need to close it to have a client's privacy. Okay, after that, put a clean gloves. And then, remove the outer dressing. Okay, and then remove the outer dressing and observe any drainage on the dressing. Hold the dressing so that the client does not see the drainage. Okay, and okay. Okay, and determine the amount of the drainage and discard the dressing in the moisture-proof bag. Discard the dressing. Okay, and then after that, remove the clean gloves and dispose of them. And dispose. Next is open the sterile dressing set using sterile technique. Okay. And next is assess the wound. Put on sterile gloves. Stop. Okay, then after that, discard. And then next is assess the appearance of the tissues in and around the wound and the drainage. Okay, assess the tissues. Okay. And the next is clean the wound. Stop. Okay, next is clean the wound. Okay, so using gauze swabs or irrigation cleans the wound. Okay, so assume that there have a water and then with the solution. So I need the syringe. Okay, and then for the irrigation of the wound. Okay. So assume that there have a water and then go for the irrigation. And then the water can flow here. Okay. Okay, so after cleansing, apply a sterile glue spot to the wound. Okay, and then we need to dry it muna. Okay. And discard. And discard. Okay, so after that is if a topical antimicrobial ointment or cream is being used to treat the wound, use a swab to remove it. So I have already used the swab and I have already removed it. Okay, and then remove and discard the sterile gloves. Okay, remove and discard the sterile gloves. And discard. Okay, and then after that, okay, next is for obtain the aerobic culture. So we need to put another gloves again. Okay, and then open a specimen tube and places the cap upside down and firm dry surface. So open the specimen tube. Okay, and then rotate the swab. And then hold the tube in one hand and take out the swab in the other. Okay, and then rotate the swab back and forth over the clean areas of the granulate tissue from the sides or base of the wound. Okay, and okay. Okay, and then rotate the swab back and forth over the clean areas of the granulate tissue from the sides or base of the wound. And then do not use pads or fold exudates to culture. Avoid touching the swab to and tap skin at the wound's edge. And then return the swab to the culture tube. Okay, so return the swab to the culture tube. Okay. Taking care not to touch the top or the outside of the tube. Crush the inner ampule containing the medium for organism growth at the bottom of the tube and twist the cap to secure. Okay? Twist the cap to secure. Okay, and then if a specimen is required from another site, repeat the steps, specify the exact site on the label of each container. Be sure to put each swab in the appropriate label tube. Okay, and then next is cover the wound with a sterile moist transport wound dressing. Okay. Okay, and then after that, arrange for the specimen to be transported to the laboratory immediately. Be sure to include the completed requisition. Okay, and then okay, and then after that, record on the clearance chart the taking of the specimen and source. Include the date and time, the appearance of the wound, the color, consistency, amount, and odor of any drainage, the type of culture collected, and any discomfort experienced by the client. Lastly, for evaluation, compare findings of wound assessment at drainage to previous assessment to determine any changes. Report the culture results to the primary care provider and conduct appropriate follow-up. Okay. Okay, so for the aftercare. So, ma'am, I have also done. Kamusta naman po yung pakiramdam mo? Okay na po? Comfortable na po kayo? Hindi po, wala pong any problem? Okay, so ma'am, thank you for your cooperation po. Now we're done. Thank you po. So, I need to go na po. And then, if you have any problem, just call me na lang po. Okay po? Okay, thank you po. Remove the gloves and this card. And then next is hand hygiene again. So, that was it. Thank you.